One of the hot topics today in the in vitro fertilization laboratory has to do with mosaicism as a result from pre-implantation genetic screening. Now, pre-implantation genetic screening, or PGS, has to do with the results we get when we do embryo biopsy. And we are doing more and more embryo biopsy these days as patients want to know that their embryos are completely normal, so we can transfer fewer embryos back to them. So when we know they're normal, we can transfer one embryo and give them a very good success rate. An older patient can have the same success rate as a younger patient because the embryo is normal. Now, with mosaicism, what happens is the embryo is not completely normal or completely abnormal, but somewhere in between. So what I mean by that is some of the cells that we take out of the embryo will be normal, and the genetic testing will tell us that, and some of the other cells will be abnormal. Now, the degree of normality or abnormality has to do with either a high level or low level of mosaicism, and that's where we have to decide whether to transfer the embryo or not. And that's where genetic counseling comes in. Now, when we do get a mosaic embryo, the first thing we do is have the patient talk to a genetics counselor to decide what to do with mosaic embryos. We do know that pregnancies can occur with low-level mosaics, maybe 40% mosaic, but higher-level mosaics, we think the implantation rate is much lower and the miscarriage rate is much higher. So this is just something that we're seeing a lot these days as we do more and more pre-implantation genetic screening, and it's just something that we're just learning with the rest of the field about these high-level and low-level mosaics.